Well, thank you for having me speak today. Can y'all hear me okay?
Yes.
Okay. So as far as disclosures, I don't have anything to disclose. The big picture of this talk is going to be to go over federal law and a few state laws, particularly California, and how they apply to AI in healthcare. We've already talked a lot about this. I know Dr. Sandbar, but for the purpose of this, machine learning, this is a system that will improve health outcomes. And what you do is you have a bunch of data. It'll just keep learning more from new inputs, and it learns by itself. Your natural language processors, this is what our first speaker is kind of mentioning about. This is what can free the doctor from the keyboard. So you can imagine being in a room and just talking to your patient in a SOAP note, or a clinical encounter being created for you to review to sign. And then another one is robotic process automation. And this is simply where you have the repetitive task, and you can train a machine to do that. And we'll go over some federal. So this is from the Department of Labor. I know Dr. Sandbar had mentioned this earlier, and this has been under development for a while. And it's interesting that the timeline of this being in October 16th of this year is when this was released. And you have to remember we had the Port Authority strike going on. One of the key things that you saw in a lot of the signs was no to automation, no robotics. Essentially, the workers, one of their core concerns is being replaced by AI and robots. And so this essentially is just the best practices and as a framework. And this is going to provide employers and developers with guidelines so that we can responsibly implement AI in the workplace. It's non-binding. It's mainly just a roadmap. And the three key principles that it's focused on is workers' right, particularly with fairness, transparency, and to make sure that there's actually human oversight in these AI systems. So where you'd have machine learning just kind of making decisions by itself, they want to make sure that they have that human oversight of the AI systems. The key elements for this is, again, to establish governance structures for AI oversights within companies. And remember, medical practices, health systems, we're all companies, so this is going to be really applicable to us. It's also one of the things that the workers are really worried about was fairness, because they could see these automated tasks being put in place for HR issues. So they wanted to make sure that there were no AI issues, and that's something that's really stressed for safeguard of the worker. And also privacy concerns with facial recognition, things like that. These are all, they have best practices for these. One of the emphases that this has is they're looking at enhancing job quality for the workers, so that AI should assist, like we talk about, assisting the physician, but not replacing the physicians. It may, if you think of replacing, it may lead to the you don't need as many physicians in the future if you can take one doc through AI and make them 10, but it's not going to replace those that are already there. And as we know, just with being tied to a keyboard and EMR, that has caused a lot of physicians, particularly in their 60s, to look at retiring. So AI can really help us solve some workforce issues there. One of the broader objectives is to make sure that it benefits all workers, and particularly those in underserved and rural communities. Real focus is those that are unskilled workers, as well as those in rural areas that could quickly be replaced by AI. They want to make sure that that does not happen. But then if you also have an unskilled worker, you could potentially upskill them through AI without a lot of training. And I did on these two slides, I put, Dr. Sandbar mentioned, these are the 8 key elements that they're focused on. The next one, this is basically HIPAA and security regulations. These are the 3 sections that will impact all AI applications on how they handle personal health information. So these systems must have, end-to-end encryption, security access, and data minimization. So you only release the data that's needed. And so you got to have the specific technical solutions. You have to have multi-factor authentication. So all these things come in once it becomes under the medical practice. And that's where, when you look at software and these programs, it's when do they cross over to where they're part of, they technically come under HIPAA. This would also require physician practices to have a business association agreement for transfer of data. A lot of this right now, if you have your EMR and you're going through that system, those third parties have gone through the EMR and they're usually included under the business association agreement that you already have. This is for quality standards. That's the section part 820. And this is the FDA's quality system regulation. And this mandates that all devices have to maintain robust quality systems. They say robust, they don't define it very well, but essentially what it's describing is software life cycle management processes. So you have to test it, validate it, and then you have to have continuous monitoring, and that way you're proving that the device is maintaining reliability. This compliance aligns with the FDA's, they have a white paper out that they call Good Machine Learning Practices. And this is so you can ensure that anything that's deemed as a medical device can consistently adopt new data. At some point, this new data, if it starts interacting with other data, can become a new device. So you just have to be aware of that. This is an FDA enforces. This is special controls on devices that are intended for human use. Again, the FDA, their job is to protect human subjects. That's one of their goals. And so they have to include these in AI and machine learning. And this regulate mandates that when you have real world performance monitoring and post-market surveillance, you have to have those two components in any AI-driven medical device. The technical requirements are going to focus on continuous quality monitoring, and then you have to have adaptive modeling, so a way to manage the model that you built as it adapts to new data, and make sure that performance is stable. And as you know, we'll see this a lot in genomic precision medicine. Imagine if you have somebody that's coming in and now there's a new allele or some genetic marker for a particular disease, and it gets put back into your model, so you can continually update people with their risk factors for certain diseases, cancers, things like that. And you got to make sure that when does that threshold go over to where it's actually a new medical device. But that quality control measure should be able to get that information to you. So then if you need to, you can go through the recertification process. And this is the code that, the statute that actually you can find the details of it. So this is data management. This is actually under the Cures Act, which is this is all applications. This is important that you have interoperability standards, and that's so you can share information within a health system, within an EMR. So hospital could talk to the physician practice, but what about when you have two separate networks? So you have hospital A, hospital B. This interoperability means that in the future, they'll have to actually talk to one another. The idea is that this will minimize tests, and it will lead to better outcomes. And the data sharing standard format that's usually used for this, it's the FAST Healthcare Interoperability Resource, and that's what a lot of people will go through. And this is what health networks use within their network, but this is probably what they're going to be using to speak to one another. There is a software exception, and it clarifies that you can, it's not a medical device if you're using it for administrative tasks. So this is meant at this time more for scheduling. But when you start crossing over to, like, you have a chat bot, for example, doing the intake, somebody that can be triaged, in my opinion, that's going to cross over from administrative task over to a actual clinical. So that would be under the human medical device. Now there is this started in 2023. CMS upguided the physician fee schedule. And what this does is it provides reimbursement for AI-supported telemedicine and remote patient monitoring. Something that that CMS had created, probably 10 years ago, was chronic disease management. And the idea was we're going to manage disease as an outpatient, treat hypertension, diabetes are really the two big drivers of this, and heart failure. And they took the most common diagnoses of hospital admissions and created a chronic disease management code and transition care management code for physicians to bill under. That was not used much by physicians. And again, you had to learn a new system. You had to adopt it to your practice. And I was surprised to find out I was one of the few doctors ever using that. Well, now with AI, you could actually have these care plans provided to the doctor to review, and then the doctor can send them to the patient. And so this is how you could actually increase your revenue in your practice through AI adoption. And this was actually put in the fee schedule, and it started in 2023. So CMS, their data is not available yet on how frequently that's being used, but this is a really key area for primary care doctors to increase the reimbursement bottom line through AI for both Medicare and Medicaid. Now, the Federal Trade Commission, this emphasizes the accuracy in AI claims. And this impacts healthcare applications that are going to require diagnostic or predictive capabilities. So you're trying to say predict if somebody they're at risk for readmission to a hospital, where are you going to place them? And this has already been used by in the past on placement of people for transition care management. But what this is now going to be emphasizing is that AI models, they need to undergo rigorous validation, and you got to have really precise metrics, which the FTC is going to, you'll submit to them. And they want to make sure that there's accuracy in reporting. This has been done previously just by looking at claims, but now they can get deeper into the data. And they are requesting, like in my practice, I submit maybe 100 patients a year that are run through their logarithms. And I figured this was eventually coming because they'll compare mine to other physicians. But now that they can get into the medical record in a more meaningful, deeper way, that is something that they're going to be looking at for claim management. Somebody had already mentioned about intellectual property considerations. One of the unique things when you write code, normally that you're going to copyright that if it's unique. But using AI technologies, and you got your diagnostic logarithms, things like that, those may qualify for patent protection, which gives you a whole another level of protection, both not just nationally, but internationally. And they're hoping this will incentivize more technological advancements in AI and healthcare. The thing you have to remember, though, is you can have all these patents and keep everything proprietary, but when you're looking at how the laws are stacking up, the interoperability is going to be really important. To me, if you have interoperability, if somebody has your data and I'm looking at it, even though it may be minimized, you could probably retrofit and create whatever program they're running just by that interoperability. But that is something that they're hoping will spur innovation in the healthcare workspace. Now, we've already talked about in general, the FDA's regulatory role. They look at software as a medical device. And this is, right now, you look at it as mainly a standalone device. If y'all don't know, one AI program that they had in Alexa, I think it's Google has Alexa. And what it was is when people would come home, you may tell Alexa, turn my lights on, but you may interact, talk about what music you're going to play. And Alexa was using that data, and they would look and say, well, this person sounds depressed. And then they may use that data, and they may make other suggestions and things like that. And so the FDA actually sued Google on that point of, is that now a medical device? And so the FDA, these are things where you can see how something very simple can quickly elevate into meeting the definition for a medical device. Just a few cases. This is this is a case from 2022, and it's Schneck versus Kaiser Foundation. And this has become a landmark case concerning AI's role in healthcare diagnostics. In this one, the plaintiff claimed that Kaiser's AI-driven diagnostic tools led to a misdiagnosis. And this is what raised a concern about who is accountable for AI impacts in medical decisions. And I think Dr. Sambar, you've already sort of talked about, there's really not a good answer for that right now. But this is something that you can see this case being cited, even though it was Kaiser won, but it was more from a technical standpoint, and it kind of underscores what we've been talking about. And it's the importance of who's responsible for this. And I think people are going for Kaiser because it's the big, they're gonna more the deep pockets. But again, this talks about how we need to do robust testing, because this case, they did confirm that it was read incorrectly, and the doctor did rely more on the on AI. And so it's how our developers and healthcare providers, how do you need to implement this for safeguards for liability that could happen from third parties directly put on the doctor eventually. This one isn't directly healthcare, but this one is from 2019. And this was Facebook using AI logarithms and data processing. And the argument was the AI systems violated user privacy. You've noticed since 2019, and if you use Facebook, there's a lot of, you go in and do your settings and they send updates regularly. And it spurred from this case, and they paid a $5 billion fine to the FTC. But you can see how this could potentially extrapolate over to healthcare. And this one is starting to be cited in healthcare case law for privacy issues. This case, U.S. versus Johnson & Johnson, this is 2022. And this was, they faced allegations that the AI-driven logarithms for treatment recommendations, they prioritize cost savings over patient care. This one was settled out of court, so we don't know all the details of what was agreed to, other than Johnson & Johnson did have to redo their AI-driven protocols. But this is something that can you can see could really underscore the importance of, if a certain treatment, regardless what the doctor thinks, they may say, let's try treatment A versus treatment B. Let's use medication A instead of B because it's cheaper, and let's try it for a month or so. You can see how the doctor could quickly get involved in these types of lawsuits. Here's a case, United States versus medical informatics. And this was from 2023, and it looked at AI logarithms that were used in ICU monitoring. The allegation was that the doctor, the hospital was relying on AI to provide the data, to provide the trends. And what had happened was it failed to detect a critical health event. So we're relying on AI to provide that critical information to the healthcare providers, and it didn't. And the healthcare providers were relying on it. Again, this one was settled out of court. And what has happened is Medical Informatics Corporation, they re-engineered all their logarithms, and what they found was they didn't meet FDA standards, so they had to upgrade to that. But there's also, how do you stay in compliance with real-time monitoring? And again, we're so far behind the Europeans in this. But this just reiterates, you got to have that technical evaluation regularly on these high stakes environment, like an ICU or emergency room. So the feds have some initiatives. They have their AI healthcare strategic plan, and this is supposed to promote standards for AI that enhance healthcare efficiencies and accuracy. They saw this as low-hanging fruit. It can really improve outcomes, get people information quicker. And the technical focus they're looking at are three main things, and it's how do you look at bias and make a determination of is the model biased against a group of people or an individual, and then again data privacy and the model to make sure it's interoperable with other systems. And these are aligning with the efforts to refine AI's technical performance. And again, good data in could mean you got a good model that's going, but bad data can mean bad outcomes. And so this initiative, it does provide funding to healthcare organizations and AI developers to make sure that they understand and meet the compliance and legal standards. This was one that Donald Trump had signed. I think it was one of his last bills that he had signed. And this is the National AI Initiative Act, and it promotes AI research and technical standards in healthcare. And it has, I listed all the agencies that are involved. Of course, you have the White House, the Institute of Standards and Technology, the National Science Foundation, and Department of Energy. And the idea is you get all these groups together and start helping us develop standardized benchmarks. So if we have benchmarks, then we'll have more effective evaluation criteria for AI models. And this is not just for healthcare. It involves a lot of other groups, but healthcare is one of the keys that they were looking at. And again, because it's so much of our federal budget. Now in the States, I like to talk about in California. This is as California makes changes, a lot of times those will come across the nation. And one of the key issues is in California, they have the landmark. It's the California Consumer Privacy Act. This was passed in 2018. And this talks about how it governs how in California, all your personal data, including healthcare, is collected by AI systems, and the consumer is the one in control of sharing that data. And then if you are using AI, imagine this, you have to disclose your data collection practices. And then this was updated in 2020, and this was Prop 24. There was a section in it that passed. And this is to protect sensitive data, your healthcare records. It is more than healthcare, but it really, there was debate on Silicon Valley, do they support or not? Because this actually puts even more emphasis on protecting the consumer. And there are certain consumer rights acts in California that could expose healthcare entities to liability. Senate Bill 1001, this is something that passed 2023, so last year, and this actually mandates, and this includes healthcare, that all businesses that use AI systems, if you're using them for decision making, you must inform the individual. I don't practice in California. I did talk to one of my friends, and he believes that what they're putting that in is when you're first coming to a clinic, establish that new relationship, that there's just information in there that gives broad protection for the provider. But this is so new that there are no cases about it at this point. This goes to bias. This is this passed in 2019, and it's it was looking at bias, and we know that that's been happening in different AI systems related to healthcare. And it's just meant for more if you're looking at patient risk assessments. You want to make sure that you have to build in metrics and things that you can ensure that bias is not taking place with your logarithm. Now, this I always look at Florida, and you see the Florida and California governors don't get along. So I look at what's going on in California, what's going on in Florida. And in Florida, it's interesting because they're actually proposing a law that is that's looking at biometric privacy legislation, and it's almost identical to what they have in Illinois. And so I do see this as maybe not necessarily a red state, blue state issue. But this is one of the things that spurred this legislation, or it's just proposed at this point. They had a gentleman walking through a hospital, and the facial recognition system in the hospital identified him as a perpetrator of a crime, not at the hospital. That data was sent to the law enforcement, who then arrested the gentleman, took him to jail, and it was a wrong identification. And this happened in a hospital while he was visiting somebody. And so that's what kind of spawned this involving healthcare. How could this happen in a hospital? And I could see, you're trying to balance these things out, but I could see facial recognition being used maybe if you have a newborn nursery and you want to make sure identifying people going in and out. But this biometric privacy law will probably have a lot of, it does include a section on healthcare data use in AI. So that's going to be an interesting thing to see if that passes. I think Dr. Sambar talked about, telehealth. There's a lot of laws that started after, after COVID began. And so there's a lot of things going on throughout the whole country. But Florida's telehealth laws was really interesting because they had to be really aggressive in 2020 because you needed a licensed physicians in your state. I know in Louisiana where I practice as well, I actually have to go through a whole teaching series about 8 hours specific to what I can and can't do through telehealth in Louisiana. I did that in 2018. Fast forward to 2020, you could submit minimal paperwork to get telemedicine licensed in Louisiana. They tried to roll that back a little bit. But with telehealth, I really look at Florida and California as two leaders in this area. I think in Houston, the Texas Medical Center, they're getting very involved in telehealth because they provide a lot of oncology services through MD Anderson. But this is something that you can obviously say how AI is going to influence greatly telemedicine. That's all I have. So I have my contact information here. I have a private medical practice, private legal practice. My academic institution, we're one college and we have 4 campuses. So we don't compete with our hospital partners. We want to be good partners. So therefore, we don't have a practice plan, but we do work with all of our hospitals throughout the state. But that's my contact information for any questions.